right, hello everybody. Having a good health, or HLTH? So George, thank you for being here. This is always fun, and I have to warn you, we only have 20 minutes, which for you is so...
2 questions.
About that. And usually I keep my questions and intros really, really short, but I wanted to take a step back here because I want to make sure everybody, you've been a big deal in the world I write about, in the world I cover in medicine for a long time, and are one of the most successful entrepreneurs and one of the most successful heads of an R&D lab in the biotech industry. But I think a lot of people outside of biotech hadn't heard of you or your company until these terrible past couple years. And now I think just about everybody has heard the name Regeneron. So I'd like you to take us back to the beginning of the pandemic. I know we were both in the New York area. We were both seeing that first wave hit. And just very quickly give people an idea of how you started out thinking about developing the monoclonal antibody cocktail that is now one of the key weapons against COVID-19.
Well, it all starts with having the technology. So we had been investing for decades to create these high throughput, we believe, best-in-class antibody capabilities that would allow us to make the best antibodies against any target better and more quickly than anybody else. And it had actually been in a previous pandemic, for the Ebola pandemic, where our team, led by Christos Kyratsous, rapidly responded in what was then world record time to go from the idea of coming up with an Ebola treatment, 9 months later actually testing it in a clinical trial in the Congo successfully, leading to the first approved treatment that really saved lives from Ebola. And it was the same team, led by Christos, who had already started adapting all of our antibody technologies to fight infectious diseases. They had a few other examples, but the most notable one was Ebola. So when I sort of first started getting a little bit worried that this pandemic back in January of 2020 might become a big deal and hit our shores and so forth, I went to talk to Christos, and he said, well, you know, we've already been following this story. We've actually already synthesized the DNA for this virus, and we're already using our technologies to make an antibody cocktail against COVID-19. And they, together with the efforts, I mean, the whole company came together to do this. They broke their Ebola record. In 5 months, we were in clinical trials with this treatment now that we know can treat people who are, you know, early stage of infections or in the hospital or prevent it. But as you said, while this was all going on, we, Regeneron, we're located in Westchester, New York. You might know the first outbreak in the New York area occurred in New Rochelle. That's just a couple miles from our headquarters. We were really in the epicenter.
It's like a train stop or two before you.
Exactly. We were at the epicenter. We all had friends, family members who were affected, who were in hospitals. And I couldn't be prouder of our people because we were actually granted an exclusion from the, you know, not going to work order. And so our people were coming into the labs every day to do their best to move this antibody treatment along in the face of the pandemic. I mean, they were equivalent of first-line workers. So I couldn't be prouder, actually, of our whole industry and how the industry responded, but particularly how our company and our people really rose to the challenge, came to work in the middle of an epicenter but of course, they were doing it because it was so close to home. I mean, they were doing it for the world, but they were also doing it for their own family and friends and family members who were affected by this horrible pandemic. So they rose to the challenge, and I couldn't be prouder of them.
Now, the monoclonals have played an important role and are keeping people out of the hospital, but they've been difficult to get, both in terms of awareness, for people to know that they should be getting them, and also you need to give them early. Have you been disappointed in that rollout at all? I mean, it's been good for Regeneron financially. You've certainly sold a lot, but are enough people getting these antibodies?
Yeah, I think that I am very disappointed in the system. I think that the biopharma industry, as I said, really rose to the occasion with not only antibody treatments such as Regeneron, but with the vaccines that we all know about. I don't understand why the forces that be, the administration, the media, couldn't explain that these were complementary approaches and weapons with which we, society and humans, could fight back against this horrible virus. They somehow seem to believe, as I said, at the top levels of the administration and also most of the media, that they could only push one story or one message at a time, that is, vaccines to protect people. And they somehow did not feel they could simultaneously communicate the message of, hey, but if you get sick, there is actually a very effective treatment that 70 to 80% of people could be saved with. I think that the failure to communicate that cost tens of thousands, if not hundreds of thousands of lives. We should have much more aggressively made this information available to the American people and let them know, yes, you should broadly get vaccinated in order to provide broad protection, but if, God forbid, you get sick, there is something to do. And very few of the public health messages, very few of the communications that came from the CDC, from the NIH, or even from the top levels of the government communicated this, and I think that this cost lives. And one perfect example that maybe we should actually talk about, which is in a continuing hole in the whole approach here, is the tragic death of Colin Powell. I don't know all the details of that, but that could probably been prevented by the use of monoclonal antibodies in the right way.
Now, so I have no idea about Colin Powell or about that case, but the idea you have here is that people who are immunocompromised, who their immune systems aren't making antibodies from the vaccine, currently they get a third dose. You think they should be getting antibodies because if they're not making antibodies, you have to give them to them.
Right, so there's two messages that haven't been getting out. Okay, one is, if you do get sick, there's available very effective treatment, because some people thought that might confuse people and prevent people from actually getting vaccinated if they knew that an effective treatment was available. So that's treating people who are already infected or already sick. And that's led to, I think, underutilization of this antibody approach. The other problem that we have is, as many of you probably know, a significant portion of the population, the estimates are somewhere between 3 to 5% of the populations, that's millions and millions of Americans, are immunocompromised for various reasons, such as the fact that they may have had cancer and undergone certain treatments, they might have autoimmune diseases and undergo certain treatments. And like you said, I don't know the details of the Colin Powell case. All I know is what's been written in the press. And they said, oh, he was vaccinated, and he may have even gotten a booster, but he wasn't effectively vaccinated because he was immunocompromised, because he suffered from myeloma and the resulting treatments which suppress his immune system. Well, scientifically, and all the clinical evidence suggests that those people should not be vaccinated, and you shouldn't be boosting people whose immune systems can't respond and make their own antibodies. You should just give them surrogate antibodies from the outside to compensate for the fact that they're not making their own antibodies. We have shown very effectively that our antibodies can substitute for people who don't have their own antibodies to prevent COVID. And the immunocompromised population, these people are true prisoners, still prisoners of the pandemic. They're afraid to go out because they're at such high risk. And vaccines are really pretty useless approaches for many of them. The science is now showing that such people, you can give them 2, 3 shots and they're not really mounting effective antibody responses. Well, if they're not making their own antibody responses, don't keep giving them a useless treatment. Don't give them the mirage, the illusion that they may be getting protection. Actually give them something that will protect them, which is regular treatments with something like Regeneron, which will substitute for their own antibodies and protect them. So these are ways in which I think the administration, the system, the FDA has failed us by not communicating to the public how many people could be saved if they were treated, if they were already infected with a treatment like Regeneron, but also the many people for whom the vaccine is not a solution, who could actually be saved by giving them this exogenously provided antibody approach.
So, talking about complementary approaches, there's been some promising data that we've seen a little bit of from Merck that there might be a 5-dose series of pills that might be able to treat COVID. Also some disappointing data today from a competitor that we won't know about that other oral drug until early next year, and there's a third one coming from Pfizer. How do the potential of having oral medicines change the use of the antibodies?
Well, I think we can use as many weapons collectively as we can get, and I think this is, as I said, ongoing credit to the industry that we are collectively all trying to respond, whether it's with vaccines, whether it's with antibody treatments, or whether it be with oral approaches. I think that it's still early in the day. I think it would be very useful to add those to our armamentarium. There's always questions and issues. Right now, the data suggests that antibodies are much more powerful antivirals than the orals are. And also that a single shot or a single treatment with an antibody approach can provide long-term protection. And if you actually are using a cocktail, it can prevent the creation of escape variants or the selection of escape mutants. All of these questions haven't yet been answered by the first oral or any of the orals. Mm-hmm. I mean, right now the evidence suggests they're not as powerful antivirals. They don't provide as long-term protection. And because of, as you said, it's a long-term, you have to get 4 pills a couple times a day for many days. If you don't get a full treatment course, just like with antibiotics, that may actually lead to rise of escape mutants and variants. So I think it's still very early in the days for understanding where and how to use these oral antivirals, whereas we know for sure how powerful the antibody antivirals, particularly the cocktails, can actually be. And I think that it would be very useful if ultimately for maybe treating, for example, outpatients, an oral approach could become part of the solution. But even in that case, I do think that perhaps the long-term use case for antibody antivirals such as Regeneron might actually be for the immunocompromised population that we were just talking about. Because there you could take a shot once a month, maybe once every 2 or 3 months, and that will provide protection. So a couple shots a few times a year might protect these people who otherwise would be constantly vulnerable to exposure to breakthrough infections that we're seeing even in fully vaccinated
I just want to emphasize that most people who are getting the antibodies now are still getting them intravenously, and for the shots, it's 4 shots right now, not 1. For all the logistical issues that do exist.
Absolutely true. We have actually tested and are testing right now, a single shot approach for chronic prevention. And those trials are actually ongoing. And so hopefully those approaches will be validated, and that will provide a convenient approach for people who might have to use this for chronic prevention. And by the way, this is not a new approach. Already immunocompromised people get something that's known as intravenous immunoglobulin, or IVIG, to protect them just from general infections because they're not making their own antibodies. And now all we're talking about is literally adding just one more powerful cocktail to that mix.
2 more antibodies.
2 more antibodies. 1 more cocktail, 2 antibodies, yep.
We've talked a lot over the years about the reputation of the pharmaceutical industry. And at various times you've had some stern words both for your colleagues in the industry and for the political system or the general public and their feelings about the industry. How do you think about that now? I mean, we have had this amazing run of productivity from companies against the pandemic. There's also, you hear, I mean, one of the main reasons people are hesitant about vaccines is that they don't trust the industry, they don't trust companies. Do you think the pandemic resets how people think about drug companies?
I would like to think so. I'm not sure that it actually does. I do think that, in every industry, there are the good players and the bad players. But I think that collectively our industry has shown how it can rise to the occasion, and we can be so instrumental in one of the biggest battles that mankind has ever waged. Think about this. It was man against virus, and our way of life was completely at stake. if we didn't have these approaches that we collectively mounted, it could totally redefine how society works. I think that we have to do a better job to explain to the world and to society, and this has been a great example. I don't think that politicians are doing enough to point out how important innovation, technology, particularly in this sector, is, and how, just like at Regeneron, but at all these other companies, there were heroes who really dedicated their lives to helping society fight back. There's too many politicians. It's an easy target. Biopharma, high prices, all this. But what they should be talking about are solutions that allow for the incentives, that allow for innovation to really accelerate, not even to stay the status quo, but to increase our ability to innovate in technology, particularly in this sector, so we could be accelerating the production of new treatments. There are so many diseases and epidemics that are coming down the pike outside of infectious disease. The allergy epidemic, the obesity,
which you have a drug
diabetes.
for.
Yeah. But this is why it's so important to I think, to tell the story correctly and have politicians not just easily target the biopharm industry and talk about how, all the bad players, but point out how critical it is for the survival of society and for individuals, and that we need to be accelerating technology and innovation, and that requires the right incentives. But as you said, we shouldn't leave anybody with the misimpression that Regeneron is all about Regencov. Obviously it's an incredibly important contribution that we've made in the last year. But we produce numerous blockbusters, like you just mentioned. We have the leading drug now for allergic diseases, from asthma, atopic dermatitis, chronic rhinosinusitis, and nasal polyps. We're going to be releasing, hopefully, phase 3 data in 2 additional major allergic indications, which is eosinophilic esophagitis.
Your marketing partner at Sanofi has forecast that drug to be what, to hit 20 billion eventually?
Well, I don't look at it that way. I look at it how many people you can impact. And when you can impact millions of people, then the money will take care of itself. But this is something that people like Sanofi are forecasting to be a tens of billions of dollar drug, because there is so much, there's an allergic disease epidemic out there, just like there was with, unfortunately.
Now, we've only got 2 minutes, but when people criticize the industry, what they're often criticizing is that they think that calculus is wrong, that the drugs cost too much and enough people don't get them, right? So maybe a final thought on that. How do you think about making price and...
Well, what I think everybody should be thinking about is the price of not incentivizing innovation. Okay, and Regeneron is a perfect example of that. We reinvest more of our profits into R&D than any other organization. That's why we have the ability to be able to respond to COVID, or to come up with the leading blockbuster in the world to fight blindness, or the leading drug against all of these allergic diseases. Or we've now rolled out a whole new pipeline of opportunities to fight back against cancer. And we're doing the same thing now with genetic medicines, and on and on. That's what the world should be focusing on. That, see how crippled we were with one infectious disease pandemic. Disease can truly take down our entire society. And what we should be thinking about is the long term, not just focused on the short term. How is it that we're going to incentivize other companies like Regeneron to invest so much in R&D to create brand new technologies that are going to allow us to fight back more effectively against more and more diseases, to allow our society to survive and thrive, as opposed, people want universal health care and all this. This has to come from new treatments that are going to control the exorbitant amount of disease that our society is now being and will be accosted with in the future.
You've got 30 seconds. What disappointed you most over the pandemic?
I thought it would bring us together. Those of us who remember 9/11, it really brought the American people together because we were united against one enemy. Here, the entire world was united against one enemy, a virus that was really threatening our entire world and our way of life. And I would have liked us to come together a lot more. And I'm disappointed, frankly, at how, if anything, it seems like we've polarized more, we've went to more extremes, and we continue to fight ourselves instead of coming together to fight against our common enemies. And I do think that disease in general, this virus is a perfect example of it, but disease in general is a common enemy for all of us and for our entire society. And as I said, if we don't figure out a long-term way of coming together to fighting back against this, which, as I said, it's going to depend on figuring out how to incentivize more and more science, technology, and innovation, and promoting science at the youngest levels and so forth. It's a long-term approach to saving ourselves, to saving humanity.
And I think we'll stop there. Thank you so much, George. It's always great to hear you. Thanks to all of you for being here.
Thanks, everybody.